I think that nowadays we are really facing also growing interest for all non-malignant disorders regarding the cellular therapies and transplantation. In particular, Autoimmune Disease Working Party is a working party within the EBMT who contribute with really the largest registry of that type in the world, with also the transplant indication and also cellular therapy use in all the type of autoimmune disorders. We are really covering now within DBNT more than 3,700 of a patient with autoimmune disorder treated with hematopoietic stem cell transplantation. And I think that one of the aim of our working party, it's related to be a multidisciplinary team. So not only hematologist and transplant physician, but also a deep connection in our group with the disease specialists, so neurologist, rheumatologist, gastroenterologist. And also we have a sort of a good connection in terms of cross-fertilization with other working parties. So we are working together also regarding the transplant complication, in the complication more related to autoimmunity and autoinflammation, and also with the innovative cellular therapy, with the cellular therapy and immunobiology working party, because we are involved for the future also in the GoCART project with the autoinflammatory and autoimmune complication after CAR T cells. So really we are facing a new era also for the autoimmune disorders. We have important results in our field that also give us a two standard indication nowadays for autologous stem cell transplantation in the field. And these are for multiple sclerosis and scleroderma. So these are undoubtedly the two main indications we have in the registry for autologous stem cell transplantation. And we are now working with all the community, also of the disease specialists, to have this standard indication also widespread all over the hospital and the center and the community, not only within DBNT, but also in the disease-specific community outside DBNT. So I think this is really an important effort in our society. And we are really also aimed to cover for the future these new fields regarding the cellular therapy and also the cross-fertilization. And also it is important to underline that nowadays we are also working with our disease specialists and our transplant physician in the team on the best patient selection, the best conditioning regimen, the best monitoring after the transplant. So I think that we can really improve also the outcomes of transplantation in this field of autoimmune disorders, as we have seen in the two sessions of DZBNT. We have seen a workshop dedicated to autoimmune disorders. That is workshop 3, you can also see on demand, and also the autoimmune disease working party session yesterday that can be also available on demand afterwards. And during this day, we have seen several presentations by our key working party members showing, for example, the importance of patient selection to perform transplantation in Crohn's disease, in scleroderma, and also multiple sclerosis. This really can improve our clinical practice in the field, because we are only having more centers that are facing and starting transplant programs in this setting. So it is important to guide also the physician in this field. And also we have guidelines that have been published recently to improve the clinical practice in the field. And regarding, for example, also the workshop we have seen yesterday, you can see here also a really comprehensive overview of autologous stem cell transplantation in the main indication, multiple sclerosis, scleroderma, and also some results regarding not only the autologous stem cell transplantation, but also the allogenic procedure, because we have also conducted in the past studies regarding the allogenic stem cell transplantation in this field that nowadays also is reserved to the most severe and refractory cases. But I think that also giving the low toxicity of allotransplant procedure that we are facing in all the hematological field nowadays, that can be also more space for allogeneic stem cell transplantation in non-malignant disorders, including autoimmune disease for the future.